was just fit to be tied in my retirement time. And I'm an old nurse, so I kind of knew what was going on. When I went to Dr. McCatchy, again with my shoulders, and he put the shots in them, the left did not work at all. And I said, well, let's do something about it. And he said, no, I think you need to get your hip and your knee fixed first. He referred me to Dr. Creech, who is just wonderful. And Dr. Creech has a PA named Hayden, who is wonderful. Both of them listen to you and are just so nice and explain everything. And Dr. Creech used the robotics on my hip. And it was a time getting through it. Hayden helped me, you know. I did okay, but I was limping. And I knew I needed to get the knee done, and I didn't want to be off center. Or I kept asking Dr. Creech, am I going to limp? Am I going to be straight? I've got a lot of living to do. And he said, don't worry, don't worry. Got through the hip, and then he did the knee. And so that's been about a year and a half ago. And it's wonderful. It's like I'm 50 years old from my waist down. The shoulders continue to mess up. And so Dr. McCatchy finally said that he would do the shoulder, and it's a reverse shoulder. And I'm 4 weeks out of this, and so far I have high hopes that it'll be great. The spur that I had in there and the sticking and the impingement is all gone. And I can say that for my hip and my knee, pain gone. I appreciate the fact that Dr. McCatchy told me, look, you got to get the hip and the knee fixed first before we do this. And he was absolutely right, you know, and just a super nice guy. And Dr. Creech, when I met him, he is so nice, very personable. Of course, both of them are surgeons, so they're gonna be short and sweet and right to the point, but they're nice about it. And Dr. Creech's PA, Hayden, is very, very nice. And Dr. Creech, one thing that stood out to me was that before I went to surgery, before I went under, he said a prayer with my husband and myself. And that was very touching. I'm a religious person, and that was nice. So, and both of them are easy to get a hold of. I use the ortho little portal thing when you want to ask them a question and you get an answer. It's great. I love it. If you've got arthritis in your knees or your shoulders or your hips, these are two guys that would take care of you very, very well. And it's best if you do it early before too late. I'm glad. I would say get it done. Don't be scared.